Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty. Right, Gabriel, tell me what's going on with your hamstring. What happened?
So there's a lot of tightness right in the center of the hamstring here. Also in this calf muscle. The calf muscle was caused I had a real bad sciatica for about 3 months, and I think I was just walking on my toes and just got a lot of knots and cramping in there.
Can you turn it around and show it to me?
Yeah. So it just right in here never really fully went away, even though I tried to massage it out and stretch it. And then the hamstring, I had knee surgery about 2010.
What kind of knee surgery?
ACL.
ACL, so you had it on the right side.
So I was rehabbing, and I just went back too quick to try and lift heavy weights. So I was doing a real heavy deadlift. And I felt a pop in my hamstring.
Where?
Right, kind of the center, and so it kind of goes all the way up, the tightness, and then there's a huge. I don't even know if you can see it on here, but there, it's real knotted in this area.
I can see it. Wow.
Yeah, it doesn't feel and look the same as
the
the
other
other one.
It's not smooth. Yep.
Yeah, and so I thought I tore it. The doctor didn't think I did. He just said, hey, it just swelled up and it'll stretch and roll it out, and it'll eventually work itself out. But so I tried to do a lot of that, and just it's so bad. It doesn't really seem to improve with all the stuff I've tried.
So this has been going on since 2010. You said? Okay.
Yeah. So any type of if I run, it starts to cramp pretty easily. Say if I'm on my knees, this is the one where it cramps real bad. If I'm I'm on my knees, sometimes, or if I reach back, sometimes it'll cramp. So it's one of those things that constantly bothers me. It doesn't keep me from living life, but it's definitely a nuisance of something that's always there.
So how much tightness from 0 to 10 you feel there? 10 is like extremely tight.
I would probably say like an 8.
8. And where do you feel that most of your tightness?
Right in the center of the hamstring here.
Center of hamstring. Can you tell me what other? So you had ACL. So where did they take the ligaments?
Yeah, they replaced the ACL with part of the hamstring.
For the part of the hamstring.
So I thought that would possibly be why the injury occurred. The doctor claimed that wouldn't be it because it's such a small amount and it was like higher up. But I didn't use a cadaver where sometimes they use a knee tendon, but I used part of my hamstring. But he thinks it was just because the muscle was weakened and I tried to lift too heavy, that I did some damage there. But definitely there's some scar tissue buildup, or seems to me. And I had another doctor after that tell me it seems like there's a lot of scar tissue
in there.
And so that's why I saw you on the internet and figured it seems like that's what you specialize in.
So did you have any other injury in your hamstring?
I had pulled it, playing sports previously, so I imagine.
Did you have fall or anything?
No. I did fall. I fell off a ladder around the same time, and you see the
look at that. That's a really
tissue
lot
here.
Of scar tissue
that was something that never really caused me any problems other than looks. It looks really bad.
When that happened?
That was probably around the same time.
Like 2010?
Maybe 2011 or 12, probably. Not. I think it was after my knee surgery, but I think I'd already hurt my hamstring by that point, so I don't think it was one of those. I don't attribute what's going on to that, but that definitely was a major fall, and definitely one of those things where you look at the tissue and you could see the scar tissue.
It's excessive scar tissue there. Yeah. So let's do the. So what kind of? So you had physical therapy. What other treatment you had?
Physical therapy. Definitely been working out. Just doing. They told me strengthen the muscles, stretching. So I even try to do some like yoga and stuff for a while. And I've had acupuncture and stuff before, and
so acupuncture, PT, what else?
And the acupuncture kind of helps for that day. You feel good, but then it's not like a permanent thing. And so other than that, I think a lot of the stretching, which I found out later that might not be the best thing, for.
It does not last.
Right,
well, it's not gonna break scar tissue. Mechanically, you cannot really break it with a stretch. It's like a rubber band. When you have a knot in a rubber band, you can stretch the rubber band as much as you want.
Right.
That knot's still there.
Right.
You have to really dig in to break it down.
Right. So I've rolled it out too. I've got one of those, you know,
rollers.
my plastic rollers, and but it's just so
it's
so dense. It's not. It's one of those things where you just I don't think we'll spend enough time trying to break it up.
So let's actually do the motion that you feel tightness. So you said like a standing and try to bend
the
your...
tightest, where I feel it the most would be this motion. That's why like sometimes when I run it will cramp up.
Is that as far as you can? That's very tight.
Yeah.
That's very tight. How much tightness
tight.
now
It's
from 0
almost
to
weak.
10?
Like I don't have the strength to flex it up more. It's just really, it's
So,
actually starting to cramp right in here.
Technically, you need to, like, your heel almost need to touch your butt.
If
it's
this one
loose.
I can do it no problem. You know?
Oh, look at this. Yeah, let's do the other side.
Yeah.
So that's a good comparison.
And so this side is.
Oh yeah, it's almost 90 degrees here.
Mm-hmm.
The other one goes further.
Yeah.
So that's one of the motion. Is there any other motion that we can use?
Usually go with this motion. I'm usually fairly flexible.
That's not bad. Yeah.
That doesn't hurt it. It's more of the stretching is no problem, but it's the flexation. Any type of where I have to contract
your muscle.
That's where it hurts.
That's when you. Okay, so most of your tightness in here, yeah? You feel this knot here?
Oh yeah, I feel that.
Okay. All right.
Just even that.
So
like I said, if you want to feel, you definitely can feel with your hand. If I hold it right here and you run your hand, you'll feel like the lumps in there.
Yep. That's
right.
scar tissue. Yeah. Yeah, so I definitely can feel that. Yeah.
You know, compared to.
I can see this. You can see.
Yeah,
this.
you can see it.
You see this bump here? Yeah. Yeah. That's really.
And whereas this one's just totally flat. You know?
Yeah. That's a big scar tissue right in here. Okay, so I know what it is now. Yeah. Okay, and here. Yeah.
It's in there too. I didn't even notice it.
Yeah, it's like an
indentation almost.
You're gonna feel it with the tools actually. It's gonna vibrate over all these areas. Yeah, definitely. So I'm gonna go deep actually, but make sure it's not painful, okay?
Okay.
Make sure it's not painful. How's that?
Yeah, it feels good.
Too much or it's okay?
It's okay.
So that's happened since your surgery? After the surgery?
Yeah, shortly after, I'd say I was.
So you got that for
3 months
compensation, probably. And you have a big one here.
Yeah.
You feel this one?
Yep.
Right in here. Okay.
And that one's only been in the last year I've had that issue.
This one?
Yeah, that was after I was dealing with the sciatica issue.
You had sciatica?
Yeah, it seemed like I must have been I think I was walking kind
compensation?
of weird. Yeah.
Yeah. So you said you did the roller on it?
Yeah, I did. I've went from trying to stretch a lot and work out a lot to do the exact opposite, because I thought, well, maybe I just need to lay off of everything. So I didn't really this past year I haven't really exercised my legs much at all, just trying to let things heal up, and I think it's probably gotten worse, not better.
Yeah.
So now probably the last maybe month I started to just kind of lift light again, get the blood flowing, but
I'll give you exercises after this.
yeah.
So just take it easy. Don't waste your time with the stretching. So
Right.
we'll give you other exercise that more beneficial than the stretching. Is it too much?
No.
Yeah, you have a thick scar tissue in your calf here.
Really?
Yeah, right in here, this area. Feel this, how hard it is?
Yeah.
It should feel like soft like this. Feel that?
So that's what knots are. Knots are scar tissue.
Yeah. You feel how hard
Oh
it is?
yeah.
That's a scar tissue. Compare this to this.
Yeah, nice and smooth.
Nice, smooth. It's not perfect. You have a little bit knots here. It's not as thick as this one. Feel that?
Oh yeah.
Yeah, that's all the scar tissue here and here. Very good. And that's just in your calf and prendius muscles. So the scar tissue in your calf is more superficial compared to the one in the hamstring. That's why you feel it here, okay?
Right.
The hamstring, you have to actually to dig in to feel it. You feel that?
Right. Yeah.
But they have to dig in because that muscle is very thick. Some patient actually could have the scar tissue very thick that, like, the scar tissue thickness is the thickness of the hamstring muscle.
Oh really?
Yeah, I had that. Actually, patient had that, and that's a really big scar tissue. But because your muscle here is not as thick as this, and your scar tissue is more on the superficial part of the muscle, so you can feel it here more.
Right.
But I'm gonna dig on the other one, but make sure it's not painful, okay? Feel that?
Oh yeah, it's like a rock.
All right, come to the edge a little bit.
Sure.
Yeah, it's gonna be some work. Feel that?
Oh yeah.
And it's like I am stuck, like I'm stuck in here. It's
That's
not
how
really.
deep it is,
Yeah, look how nice and smooth it's going here.
Yeah.
But here, it's like your whole. It's just holding you. That's a very, and that's a thick scar tissue here. So we really need to work on this. I'll not be surprised. I'm not surprised that could be actually shorten the length of your hamstring. Yeah.
Possibly, yeah.
Yeah. Feel that. It's like it's too thick to the point that tool is not going up here.
Yeah.
Just stuck here. Not going any further. So it feels like a line of scar tissue right in here.
Yeah.
Sorry, I got lotion everywhere.
That's right.
You feel also a little bit scar tissue that's more superficial. Where did he cut it? Maybe around here actually.
Really?
The medial part. Usually the medial. Is it too much?
Only when you go lower. Like right there, it's fine. But
Okay.
it's fine.
Okay. Lift your leg up.
Yeah.
Relax. Okay. Too much. That's the deep scar tissue. Do you feel the vibration here?
Yeah.
That's when you, in the other position, you will show it to show in this area. That's deep, which is actually not too bad because the scar tissue is deep. It's not like the full thickness of the muscle.
Right.
But you can feel
Oh yeah.
it's kind of vibrating here.
So it hurts down there. Right?
Sorry. So that's the area you feel it's cramping. Is that correct?
Yeah, higher up.
When you try to flex your knee. Okay.
Yeah, I probably feel it from the middle of the hamstring all the way up to my glute
Yeah.
almost, you know.
Feel that here?
Yeah.
Make sure this is not painful.
A little bit.
Sorry.
Yeah.
And here, feel
Yeah,
that?
it's a little painful there.
Sorry.
That's all right.
But you see, I'm actually going deeper for this.
But yeah.
Because when I work superficial here, you didn't feel
Yeah.
anything.
Right, right.
So the good thing is about this tool, actually we can go really deep. But make sure it's not too much. Okay.
Yeah, it hurts a little bit.
Sorry.
Just because it's, I don't know, it seems like my legs have always been a little more
When
sensitive.
you have excessive scar tissue, that could compress on a nerve ending
Right.
on this area, so it make it more sensitive.
Right.
Man. Okay, I got it to cover.
Yeah, actually on the On this, it doesn't hurt, so I don't know if the nerves are damaged. It's more like off of that it hurts, yeah.
You might have permanent damage here. That's when you fell on it, yeah?
Yeah, I fell off a ladder and I landed on the ladder.
You landed here?
Yeah, because the ladder fell on the ground sideways and then I
lucky.
fell. So rather than hitting the ground, I landed on the ladder, so all my weight was on that point.
You did not hit your head and had concussion. Yeah.
In a certain sense, it kind of kept
lucky.
me from, landing on my whole body, so it was good, but did a lot of damage there.
Well, it's better than hitting your head,
Yeah.
Okay, so let me feel that. That's a band here, okay? Too much?
No.
Okay. Is that too much?
No.
Gabriel, you get some work to do here. You visually can see the thickness of it.
Yeah. That's pretty unusual.
What?
That's pretty unusual, right?
Well, it sounds like your body built excessive scar tissue. So there's some people that, in perfect scenario, okay. So the body has to go through 3 stages in order to heal. First stage is inflammation, second stage is the proliferation, third stage is the maturation. Again, I use external paper cut for visualization, but the same process happens internally. So the first stage is inflammation, like when you have a paper cut, that's a swelling, redness, and the blood starts to rush to that area. Second stage is the proliferation, that's when the body starts to build the scar tissue. The last stage, the maturation, that's when the body actually dissolves the scar tissue by itself. You're definitely not in maturation.
Yeah.
You have excessive scar tissue here, so your body built but not breaking.
Right.
So that's what I try to do with those tools is actually doing what's supposed to be done in proliferation stage or the maturation, that breaking down those scar tissues, so your body will transition to the maturation. But that's a lot. And sometimes when you have it a lot like this, it could be genetic, excessive scar tissue, but genetically your body did not break it,
Yeah.
So we'll work on that. Okay, sorry. All right.
Normally it was, I think I said it was just an 8, just standing around.
Yeah.
So now it definitely feels dissipated, probably down to, like a 4.
You feel it 4 there? How much?
Yeah. So now it's a lot better. So it was at a 10.
We get some more too.
Now I feel it only at the very top in here,
Mm-hmm.
So went from like a 10 to like a 5 maybe,
And you feel it in that spot, yeah?
Yeah, it's actually.
Mm-hmm. We still have some. It's going a little bit further, yeah.
Yeah.
It used to be 90 degrees. So let's actually lie on your back, head here. And you said your oh wow, feel that. Okay.
Have a nut there too?
I'm not surprised. So
You said you feel one there?
yeah, you feel those lump here?
Oh,
It's not as bad.
Yeah. I see what you're saying, yeah.
You feel that? Okay. Here's not too bad actually. And here. It's all in here. And you can see it, the redness. Feel that? Okay. You need your quad actually to lengthening while you're doing that.
Otherwise it's pulling on her.
Otherwise one side is contracting and the other side is like like pulling the other way.
Right.
So I need to work on the quads too. It's not too bad like the other side, but that could cause some restriction and co-contraction of the hamstring and the quad muscle. You can see how all this okay, let's actually, while you're here. Okay, so tell me about your hip, your swell. What's going on with that? So while you're here, we'll just release that. You said you're psoas or...
Oh yeah, I just noticed my hips have always been tight, even since I was a little kid.
Okay.
And
so
it's
okay to work on this. Your hip flexors.
Yeah.
Is tight here more than the other side. Yeah.
Yeah. Yeah.
So you need all this muscle actually to work perfectly to give you the length.
Right.
You know, even like some of those muscles secondarily help with that motion. But if it's you have tightness here, it's gonna kind of pull this way, opposite to the other side. That's why I just wanna release the entire thing here and see how that. Feel that? Got a scar tissue here still.
Really? Right.
Yeah. Yeah. You feel this bump?
Yeah, I thought that was just my bone.
Your scar tissue around your bone.
Oh, okay.
Okay, yeah, I'll show it to you.
Yeah, you know what? I think I had one.
Yeah, surgery.
Baseball? No, I
It's
think it
like
was
a
just
scar tissue.
I think sliding from baseball. I always like
Yeah.
when I slide head first, it always like scratch up there. You know the.
Oh.
It would. I was getting.
I see scar tissue actually. Visually, I see marks.
I think I crashed on my bike one time too.
You did in here.
Like a BMX bike, you know, and
Wow.
kind of scratched it up. You know?
Man, you're beating your body.
I know.
So this vibration, that's
Yeah,
a scar
scar
tissue
tissue, wow.
over your bone.
Okay. Wow.
You know.
Oh yeah, I see what you're
You
saying.
feel that?
Oh, my
You feel
God.
that? Yeah. It's rumbling. You know.
Mhm.
Yeah. Feel that here?
Mhm.
Yeah. Here. It's hip flexors. You can get deep. I worked on releasing your psoas here with the ASTR tool, going deep. Man. Now you get lotion all over you. It's your fault.
Yeah.
Feel that here?
Oh yeah.
Okay. So.
Wow, look at that. Actually, you're moving your hip flexor more now.
Yeah.
Yeah.
Yeah, it definitely feels looser there.
How much tightness from 0 to 10?
I'm probably down to like a 4 now.
Where?
In the hamstring. So I
Okay.
started off like at a 10, and then
Mhm.
5, and then after that last session, probably down to 3 or 4.
Let's compare it to the other side. Turn around and let me see how you do the other side. Okay. Can you do the this side? You don't flex your hip.
My right side or left side?
Yeah. So can you do the other side without
Yes.
flexing your hip?
Oh, without. Okay, so yeah, so here just no hip.
Yeah. Good. Let me see the other one with no hip flexion.
No hip.
No hip extension, I mean. Okay. Okay. So you feel it on the top, like right in there.
Yeah, so I start to feel the cramping probably from here.
Ischial
in
to
that
press,
area.
yeah, okay.
It just starts to get it starts to cramp.
Okay, so let's line your stomach.
But the size of the cramping, is it start to shrink a little bit?
Yeah.
Okay, so that's what I care about. That's a good sign actually, because when you have like the whole area is cramping, that's a lot of tightness everywhere.
Yeah.
When we start to break the scar tissue and release the fascia, it's gonna shrink the size of the tightness
Right.
and the cramping until we release the whole thing. So you feel it right in here, yeah?
Uh-huh.
Okay. It's right in the ischial to cross. Is that too much?
No.
Okay. Okay. Is it right here? Like where you feel the cramping? Or
Actually, probably a little below that. Yeah. Like the first one was like right at the top of it. So from there down. about
Right here?
Yeah.
I was here. Right in here, yeah?
Yeah.
So this not here? Is that where you usually feel it?
That's kind of at the top of it, and then I feel it like below that too.
Okay. So that's where your hamstring attached to your ischial tuberosity,
Okay.
that area. And that's probably why you said you feel it more with sitting,
Right.
you know? You feel your hamstring. Now, we'll do the sitting after we finish the treatment.
to check how you, because you said you feel constant tightness in the hamstring we're sitting to.
Right, yeah, like where your other hand's at, I feel
Yeah.
that's where the tightness usually is at, and then if I flex it, it starts to raise up.
You said you had a back issue. Is it okay to work on your back a little bit?
Yeah.
Okay. So relax. So when you had the back issue, it was where?
Just lower back there.
Lower back.
Yeah.
Okay. You feel that tightness? Okay, it
Oh,
should
yeah.
move like this. Your superficial fascia.
Yeah.
No, you can see it here. Sorry, I got some motion. Get some motion in here. Okay. So, this is normal fascia movement compared to this. Feel how tight?
Yeah.
Is it?
What's that from? Just from the muscles being weak around there?
The same reason that causes scar tissue actually causes fascia restrictions. Accident, trauma, poor posture, poor body mechanics, even repetitive strain injury.
So that's scar tissue there too?
That's a fascia restriction. So fascia,
That's in the second stage?
fascia is like a wrap surrounding the entire body. That's a superficial fascia.
Okay.
Fascia is like a very thin layer that's wrapping the entire body.
Right. Yeah,
There's-
I saw that, the video on that, yeah. Like a little...
So there's several layers of fascia. Think about the superficial fascia is like a Spider-Man suit.
Okay.
When your fascia is restricted, it's like you're wearing a t-shirt 2 to 3 sizes too small.
Okay.
So it pull on everything and compress on everything. It's actually, it feel like suffocating those tissue underneath it.
Right.
And some patient complain of like feeling banned.
Right.
That's actually fascia restrictions most of the time. So when you have fascia restriction and it's actually compressed on everything underneath it, it's gonna restrict your range of
Right.
motion. And the same causes that causes scar tissue actually cause the fascia restrictions.
Okay.
Because there's a lot of fibroblast and myofibroblast tissue in the fascia layer. So when you build the scar tissue, you're gonna build it around the fascia layer too.
Right.
So it's actually when there's an injury occur, they usually fascia restrictions / scar tissue / muscle spasm / trigger point happen in the proliferation stage. The restriction could be more from one of the 4 or the combination of the 4.
Okay.
Most of the time it's combination. So so we have to release all of that.
Alright.
That's further.
Mm-hmm. Definitely feel less. It wasn't cramping as much.
How much?
So that time I didn't really feel it cramping at all. So it was a little, like I feel weaker on this side. So it's probably down to like what I would say like a 3, you know. But definitely from a 10 to down to
3.
Yeah.
Okay, where do you feel it?
it just feels weaker now. Like I don't have the same strength. Like I could just, like this one I could just go straight back.
Yep.
And even that one I feel starts to like tighten up.
Tighten up. Okay.
And then this one I have to like think about lifting it. And I feel.
You definitely like weaknesses. I expect that because when the last time you were able to do this?
Yeah, I haven't done it in a long time.
So definitely there's weaknesses. My concern, I want to get the tightness down. So the tightness now is
probably like a 3.
3.
Yeah.
Where do you feel it exactly?
More so in that area. Yeah, the right in that center hamstring.
Center hamstring.
Mm-hmm.
Oh, the center hamstring. Okay.
So, like from where you're, like from here, just kind of up to here.
Okay, there you go. We got it. Okay. Even though you feel it here.
Oh yeah, I definitely feel that. Oh yeah, I felt that there.
Too much?
No,
Okay.
it's almost like a nerve or something.
What do you feel when I'm doing this?
Just like it's.
Pressure or you
Yeah, I
feel
feel
pain?
pressure. I don't feel pain now.
Okay, as long as you don't feel pain, that's fine.
It almost feels like there was a pinched nerve there or something.
Make sure there is no pain. You should feel pressure. That's
Yeah, I feel
okay with
pressure.
the treatment, but pain, I don't want to cause
It's
pain.
really tight there. Yeah.
Okay. And when you feel that, you feel it deep in or superficial, the tightness?
Deep.
Very deep, okay? So I'm getting into that spot, okay? Just want to make sure. Do you feel the stool going as deep as far, like, to that point?
Yeah.
Okay.
I feel like on that one right there, you probably could even go deeper.
I can go deeper,
Yeah.
okay. Yeah.
The other one was pretty deep.
Yeah. Well, the good
Yeah, now
the good thing about this design, actually, we can go really deep with this as long as you tolerate it, okay? To release it. Okay.
oh yeah, definitely feel that.
Too much?
That's good right there.
Okay. Alright, so I'm not gonna
That's where it's really tight though, yeah.
okay, I'm not gonna go too deep here, okay? Until you tolerate it, okay?
Probably a little deeper now.
Go deeper or
yeah,
less?
keep going a little deeper.
I can go deeper, okay? There you go.
It's about warmed up.
Is it good enough?
Go a little deeper.
Okay, what about now?
A little deeper.
A little deeper? This good?
A tad deeper now.
Tad deeper, well, this enough?
Feels good, dude.
Yeah, I think I feel like I'm going closer to your bone now. I don't know if you feel that.
Definitely feel it releasing even from when you first pressed it like tight, and I just kind of felt it
Mm-hmm.
slowly loosen.
Yeah, yeah. Yeah, so your tightness is very deep. Okay, and I'm gonna release it now. Here you go. Alright, that went deep. Okay, sit up for me.
Wow, yeah, it just feels so much better now.
Mm-hmm. Going that deep, because your tightness was that deep.
Yeah,
Yeah.
like just standing here, like I don't even feel it.
You don't feel it now?
So when I flex, I can feel a little, it's down to like a 2.
Beautiful,
but,
okay.
But when I'm just standing here, because normally I feel it all the time.
All
It's
the
not
time.
something where it's in pain, but it feels tighter.
Mm-hmm.
And standing here right now, I feel like I can go out and run a mile,
Beautiful, yeah, let's try it again.
Okay.
Bending.
Oh, bend, yeah.
That's beautiful, it's going further now.
And then yeah, if I bend my
Mm-hmm.
hip, it's easy to even go higher where I couldn't do that before.
That's beautiful. Let's have you sit. So, because
Sit.
you were saying like sitting.
Oh yeah.
We'll turn the chair toward me.
Yeah.
Okay. And we'll have you sit and tell me, because you were saying like you felt it was sitting too.
Yeah. Right now it feels fine. Like I don't feel it doesn't feel tight.
Okay.
Feels nice and loosened up.
Beautiful. So you had acupuncture, you had PT. So what do you think, like with ASTR treatment? Can you tell any difference? How do you feel?
Like this one treatment, was worth a year of stretching and anything else, acupuncture, lift, So
Yeah.
because even after a stretching session, it feels better.
Okay.
But like you said,
Does not
it
last.
immediately, like for an hour, it'll feel better if I go play a sport. But then it'll tighten up. But then even with the stretching, it goes from maybe like a 10 to a 6, to where it's like I could function, but. Whereas this, it definitely loosened it up,
Yeah, awesome. Thank you.
Cool.
Yeah. Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment, and feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.